Good afternoon.
Good afternoon.
So please tell us who you are and where you practice.
My name is Dr. Daniel Scherer. I'm a chiropractor here at Lovett Chiropractic in Amarillo, Texas.
And you're one of the doctors on the team at Lovett Chiropractic. And I would like for you to rate your experience as one of the team members at Lovett Chiropractic. On a scale of 1 to 10, with 10 being high, how would you rate your experience?
This is my dream job, so I'd give it a solid 9.5, and only because we're not set on a beach
Okay,
somewhere. But
that
with a
makes
40 work
sense.
week, I can certainly get to a beach if I wanted to.
So now, most young doctors who come out of school and go to work for other chiropractors don't have the good experience that you're having right now. Why do you think many doctors have a bad experience with their associateships?
I've actually had the experience of a bad associateship in the past. I've found that the main thing is that the systems aren't set up, that you kind of feel lost when you're in an associateship. The doctor actually, treats you almost like, hey, this person associates with me, but that's about it. That's about as far as it goes sometimes.
So you don't have any support, you don't have any training, and it sounds like you may not get some respect. And by the way, I've heard those stories too. Now, you said that your job with Lovett Chiropractic is your dream job. Can you give me a few things, a few pieces on why you really like this position?
Sure. First of all, you mentioned respect. I mean, obviously, gosh, the first day I ever walked in here, they were expecting me. I walked in the door, even not as a patient. They said, "You must be Dr. Scherer. We've been expecting you. Come on in." And they introduced themselves, and I said, "Wow, this is from the assistants." So I was wowed right off the bat. But when I met Dr. Lovett, who trained me, brought me in. I mean, it was you. The thing I love the most is if I have a goal that I want to reach as a practitioner, I have a big team around me that asks me quite often, where do you want to go? How far do you want to go? And they push me. And we have what's called a staff-driven practice, which means that we've trained our staff to push the doctors. They point exactly where I need to go, who I need to treat, and then I can be a doctor. That's what's wonderful about being here.
And so you were trained especially to adjust and how to take care of patients also by Dr. Lovett, am I correct?
Correct. Yep.
Super. So now, if somebody had an opportunity to join the team, what would you tell them that they would find there? And what advice would you give them about taking advantage of that associateship or staff doctor position?
So, first of all, there's a system set in place. So from day one, there's certain things that you want to learn about the office, about how to be a doctor. What I love about it is that you get to see a high volume of patients really fast right out of the gates. So you become a good doctor because you have to make decisions fast, important decisions fast. Um, you have to have just this present time consciousness of, whoever's in front of you, they get all your attention, and that just keeps you honest. As a result, it turns around and, over 60% of our patients refer their friends and family. And it's such an honor to be able to take care of those people too. To be trusted is such a great feeling.
Well,
I think.
one of the things that I did hear from Dr. Lovett and also from Jeannie is what great work you do and how your patients love you.
Thank
And
you.
it sounds to me like you are truly in a position that is a dream job. And so I thank you for the opportunity to chat, and I'll talk to you later, okay?
Thank you. Have a great day.